Hi, my name's Ian Brocklesby. I'm a physiotherapist at Hallamshire Physiotherapy in Broomhill in Sheffield, and I have a special interest in dizziness and balance problems. Dizziness is an incredibly debilitating problem, whether it's an acute episode, as in recent onset, or whether it's a chronic episode, as in it's over 3 months in duration. We put these videos together in order that we can give patients some advice and hopefully some reassurance if they feel like they may have some of the things that we're going to be talking about. If you do decide you want to see somebody, or chat to somebody and discuss the problem, we are offering FaceTime consultations or telephone consultations, which can be arranged through the clinic on 0114 267 1223. Now, what I thought I'd do is we'd start off with the most common condition that we see at the clinic, which is BPPV. Now, BPPV stands for benign paroxysmal positional vertigo. Benign meaning it's non-life-threatening. Paroxysmal meaning it's short duration bursts of dizziness, intense dizziness. Positional meaning it's associated with head position or movement. And vertigo meaning the sensation of spinning, the room spinning while you're standing still. Now, BPPV is associated with movement, so the symptoms tend to come on when you turn over in bed, when you look up and down, or something similar to that. Okay? And the reason it happens is you have two motion sensors within the inner ear which contain calcium carbonate crystals. Now, due to infection or a blow to the head or something similar, these crystals can become dislodged and go from where they should be into what's called the semicircular canal. And what they will do there is stimulate the sensation of intense dizziness. Now, this dizziness lasts usually between 10 and 30, 40 seconds in duration. BPPV will not cause long-term dizziness, as in intense dizziness for hours or days. BPPV won't cause numbness or pins and needles or problems with speech or anything like that. What you may notice is that while you're having these short duration bursts of dizziness, you will also have, or commonly have, eye movements which are called torsional nystagmus, and your partner or a relative or a friend may notice that while it's happening you may get this tick 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 sensation with the eyes. Okay, now how do we treat BPPV? The usual gold standard treatment for BPPV is what we call a manoeuvre, or a series of exercises to get the crystals from where they are back to where they should be. Now, this manoeuvre, the test for it is called the Dix-Hallpike test. The manoeuvre is called the Epley manoeuvre. Now, there are a variety of things on the internet that give you advice on how to do this yourself. However, I'd strongly recommend you don't try these, because if they're not done correctly, it can cause the crystals to go into where they shouldn't really be, and it can cause more dizziness. It can occasionally work, however, I would strongly recommend, unless you're incredibly confident, that you don't go down the road of trying this, because it's just not worth it. What we do tend to say to people is, when you have this problem, is try and keep hydrated. It's really, really important, because you may get nausea. The other symptoms, of course, that can coincide with BPPV are nausea and sometimes vomiting. You may get this feeling of disequilibrium or feeling of imbalance in between episodes of dizziness. And often you'll not feel like eating or drinking very much. Now, of course, it's important that you don't let yourself get dehydrated. So drinking enough fluid to keep you from dehydration. Trying to find somewhere to relax, somewhere safe that you can just sit and shrug the shoulders and just keep the trunk moving a little bit. Okay, because we tend to, when we're dizzy, we tend to get very, very stiff and very, very tense. Okay, and it's obviously very, very common that's a common thing that people will do, is keep themselves as rigid and stiff as you can. Try and keep as mobile as you can, but safely. Of course, if you're having intense episodes of dizziness, you don't want to be walking around and falling over, because that isn't safe. Okay. I hope this has been helpful, a little bit of advice and maybe a bit of reassurance for some of you. If you do want to have a little bit a further chat about BPPV, do, as I said earlier, contact the clinic and we can have a chat over the phone or on FaceTime. I'm going to be doing a few more brief talks about some of the more common things we tend to see at the clinic. I hope this has been helpful. Many thanks. Bye-bye.